80 health workers test positive for COVID-19 as NCDC confirms 566 new infections. Federal Road Safety call to create special task force and driver's license vehicle number plates. In international news, former police officers charged in George Floyd's death appear in court for a second pre-trial hearing. And in sport, Malaysia sack manager Silades.
This is ANN News.
I am Olajumoke Olatunji. Nigeria has confirmed 566 new cases of coronavirus on Thursday. This brings to more than 25,000 the total number of COVID-19 cases in the country. Nigeria's Center for Disease Control reviewed the infections were recorded in 20 states. Lagos posted the highest number of cases with 166 new cases. Oyo followed with 66 infections. The agency says 9,402 patients have been discharged so far. And the CDC says in the absence of a vaccine, Nigerians need to adhere strictly to its guidelines of wearing face mask, physical distancing and hand washing. The agency says these are the most effective strategies to limit the COVID-19 spread. The agency reviewed 18 local governments across the nation that accounts for 60% of COVID-19 cases may face imminent lockdown. PTF Chairman Boss Mustafa, who spoke at a news conference after briefing President Muhammadu Buhari at the end of the 4-week gradual easing of lockdown, says the reason for the precision lockdown is to place specific measures that will be administered by state governments and local authorities. The federal government has approved what it calls safe reopening of schools nationwide, which includes only graduating pupils in primary 6, JSS3 and SS3. Higher institutions, daycare centers, and other classes in primary and secondary schools remain closed. The government has also lifted the ban placed on interstate travels with effect from tomorrow. Ban on local flight operations has also been lifted. Passengers would now have to be at the airports at least 3 hours before their flights to observe health protocols instituted by the airport authority. Many Nigerians have now given in to self-medication amid fears of being turned back from the hospital for lack of treatment facilities. They are also concerned about the increasing rates of infections among health workers. Correspondent Deji Badmos has the story.
Fidelia has been self-treating for malaria. She suspected she has the common ailment and went to a pharmacist to get an anti-malaria medicine, which she's been taking since the onset of her symptoms. Pre-COVID-19, she says she would have gone to hospital to see a doctor and have a test done before commencing treatment. But she says she's scared to do that now.
I've also read about people going to the hospital probably with a headache and coming back with COVID-19. And we have cases of health practitioners getting infected as well. So I just felt the hospital wasn't so much of a safe ground.
It's a similar story for many Nigerians who are staying away from hospitals for fear of either contracting the virus or being told they have it. Before the outbreak of COVID-19, the waiting room of this private hospital in Lagos was usually packed with patients waiting to see the doctor. But since the pandemic hits the city, many have been staying away.
There's a lot of misinformation and disinformation going around there all over the nation, and this makes a lot of people not to want to actually enter hospital because in their own perspective, hospital is the reservoir for COVID-19 diseases.
Like Dr. Mebanwadu's hospital, most private medical facilities are now struggling for more patients.
Pre-COVID, of course, as a quiet, simple place that focus on some area of medical care, between 15 and 20 cases are seen, on a day. If you look at the statistics, maybe, on a day that you're not having those, maybe about 10 will come and then you'll be able to attend to them. But during the COVID, it went down to BRS minimum, maybe 2, 3. But now you barely see 5.
The story is no different for state-run hospitals, which people patronize the most. Even though patients still continue to come for medical care, the number has gone down drastically.
Of course, people are in the public, they're telling each other, don't go near a hospital now, because you can never tell. Patients can have COVID-19 on this. But people that are sick are still coming, and we are still attending to them.
Some patients are choosing to stay away from medical facilities because they say even those with common symptoms like a fever are approached with suspicion at the hospital.
Sometimes you don't even wish you're sick. You don't even wish that people around you should be sick, because the nurse and doctors, they'll be looking at you with a different eye whenever you appear, and the way and manner the responses are so disheartening sometimes.
The doctors say with COVID-19 testing centralized and limited to mainly isolation centers, majority of hospitals in the country, both private and state-run, are not able to diagnose for the virus. And for that reason, health workers maintain a high index of suspicion when dealing with patients.
Even if somebody is having cough and fever and malaria, instead of you to treat normally and wonder, that I'll do COVID-19 test later, you can't do that. Because once you say you are treating and then it later ended to be COVID-19, the government will come and say, look, listen, where are your contacts? Where are the people you've met before? Then they have been to this hospital, and then the hospital will be stigmatized and probably be closed down. So it's a complex thing.
It's indeed a complex situation, and it's the reason why many like Fidelia are not willing to take the chances, but rather treat themselves at home instead of going to the hospital.
Minister of State for Labor and Employment Festus Keyamo has accused some political leaders of attempting to blackmail him into surrendering the innovative public works job creation program meant to create nearly 800,000 unskilled jobs for Nigerians. Keyamo says only President Buhari can stop him from piloting the program. The minister was speaking at the inauguration of state selection committees of the federal government's public works program. He says any chairman who fails to adhere to the guidelines on the operation of the scheme would be removed. The minister says certain persons who had been entrusted with such programs in the past had surrendered them to a political leader or political leaders as a form of patronage. Keyamo says the public works program is for all Nigerians, and the federal government has structured it to be bipartisan to reach every Nigerian, irrespective of political leanings. The Federal Road Safety Corps FRSC says it has embarked on a mission to create a special task force for enforcement of vehicle number plates and driver's license to sanitize driving culture in Rivers State. The new sector commandant in the state, Corps Commandant Salisu Galadunshi, said this while on a visit to the Secretary to the Rivers State Government, Tamin Danagogo, in Port Harcourt. He said the initiative would ensure the safety of lives and property for road users as well as enhance revenue generation for the state. The sector commander also said the state now has a replacement mission center for number plates. Coming up, African stories. Uganda postpones border opening to DRC refugees. And later, international news. Former police officers charged in George Floyd's death appear in court for second pre-trial hearing.
You are watching ANN.
See you tomorrow, Papa. I am happy and I know I'm free.
Now time for meeting. Any landlord when no show go pay fine.
Make I go call her.
House number 1. Present.
Papa, they don't stop me too.
House number 5.
And they're angry that you are not here.
Just put me on the window there so that I can see them and I can hear them.
He's not around, so his house is sanctioned.
Present. I carry data for head, I carry them for back. Correct data I know the payment. Say I know they know me, say I know this yoga landlord. Talk to me face to face.
Explore without limits. Turn it up on MTN, the reliable data network.
Driver, fire ahead.
Welcome back. This is ANN News. Uganda has now walked back its earlier decision to reopen its border to refugees fleeing conflict in the Democratic Republic of the Congo. The government says this is necessary to ensure wrong people with sinister motives do not cross into the country. Correspondent Isabel Nakia reports.
Uganda says it's heightening security at the border fast. The government says it wants to ensure wrong people do not take advantage of the reopening of the border to enter the country. In March, more than 100 armed men crossed into the country from DRC and attacked a military base in northwestern Uganda, killing 5 Ugandan soldiers. 2 of the attackers were gunned down in an exchange of fire, while the rest were repulsed. Coronavirus testing and isolation facilities are also being prepared before the refugees arrived. All the refugees will be required to take mandatory COVID-19 tests and also be quarantined for 14 days before settling in. The situation across Uganda's border with the DRC remains volatile following ethnic clashes that have killed dozens in the country's Ituri province. Uganda closed its borders in March as a measure to slow down the spread of COVID-19.
The city of Cairo and other major cities in Egypt are working to ensure their public transport system is safe from the spread of COVID-19. The challenge is great in Cairo, the capital city, where more than 18 million persons live. Correspondent Adil El Marouki tells us what it would take to accomplish the task.
The Egyptian capital accommodates some 18 million residents. Squeezed between the banks of the Nile, getting into huge crowds is inevitable for most people. So public transportation had to somehow cope with the COVID-19 pandemic.
We've created a workforce in all metro stations to disinfect all places commonly touched by hands during daily operations. That includes escalators, handrails, staircases, ticket gates and kiosks. At the end of the day, all trains then head to the maintenance areas for a complete inside-out wash.
3 million passengers commute in Cairo's metro daily. Above the ground, buses see multiples of that figure. So for commuters, it's not an easy task to keep a safe distance.
I spray my hand with alcohol. I wear face mask. I try to keep everyone in my house safe. Whenever I interact with a stranger, I disinfect my hands. People are now much more careful than when the pandemic began.
Not all commuters are that diligent when it comes to keeping a face mask on whenever in public.
I only care about the face mask when I'm in crowded areas. In open air, I put it in my pocket. I use buses, metro and trains daily. The crowd is the same, it never changed. And we don't have the luxury to skip crowded vehicles because we don't want to be late for work. People have learned a lot from this coronavirus pandemic.
Wearing a face mask is mandatory on all public transportation. The pandemic continues to pose challenges for commuters and public transport operators, especially during rush hour.
Public transportation passengers are now much more aware of their personal hygiene safety measures. So even if the pandemic is over, many Egyptians will keep using these measures to keep safe during their daily trips.
The new coronavirus pandemic has forced many businesses around the world to experiment with their employees working from home. Zimbabwe is testing the same idea as many workers have been performing their duties from home where possible. But experts say the idea cannot be sustained for long as homes and workplaces have different roles. Correspondent Faraya Nwakutuya reports.
Keeping my station, your station, ZFM Stereo. Good morning.
Since April, Patience Musa has been presenting her daily radio program from the comfort of her living room. WhatsApp and other social media make this improvised arrangement work.
I have my laptop, I have to use my phone, of course the connection through to the studio, the phone a lot because I have to communicate with the guy in the studio as well as everybody else who's also participating on the show. It has its moments, but it's comfortable being at home. You can't run away from that.
It's working for now, but may not be viable in the long term, according to experts who've observed that over time, productivity begins to suffer and businesses have to bear the extra cost of getting their employees' homes work-ready.
The home environment was never meant to be a work environment. You also miss the collaboration because you don't have the connectivity that you require. You miss the collaboration. If you're in the office environment, same location, if I got a problem, I just walk into your office and ask a problem. Then we solve the problem very quickly. If I WhatsApp you now, it can take an hour before you respond because I don't know what you're doing.
Some employees could be taking advantage of the situation to do things completely unrelated to their jobs, or may simply be juggling many responsibilities at home.
Kudzaim Baiwa, who has to help her son with schoolwork and run her consulting business, says separating duties is key.
9 and 1 o'clock when he's doing school, I can do very mundane tasks, be present to assist. So from my work perspective, I can do mundane things on my phone, perhaps check up a few emails, make some calls, things that don't really require thinking. And then we all break for lunch from 2 o'clock thereabouts. I'm much, much more productive.
But she says being on the ground beats being behind a desk any day and hopes she can return to the traditional work arrangement soon.
When we return, international news. Former police officers charged in George Floyd's death appear in court for second pre-trial hearing. And later, sport. Valencia SAC manager, sports director resigns.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, African News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. The 4 former Minneapolis police officers charged in the death of George Floyd appeared in court on Monday for a pre-trial hearing. Derek Chauvin, the former officer charged with second-degree murder in Floyd's death in late May, appeared remotely by video. Correspondent Don Williams has the story.
A return to court for the former police officers charged with the killing of George Floyd just over a month ago. Thomas Lane and J. Alexander King, both out on bail, appeared in person at the court, while Tu Tao was also there but in custody. Derek Chauvin appeared remotely via closed-circuit TV from the state prison where he's being held. He's charged with second-degree murder and second-degree manslaughter, while the other former officers face charges of aiding and abetting. Prosecutors told the court that they've now gathered around 8,000 pieces of evidence. There was also a warning from Judge Peter Cahill to all parties to stop talking about the case publicly, threatening a possible gag order or a venue change if the pre-trial publicity continues. The court appearance lasted around 40 minutes in total. Afterwards, Floyd's aunt, Angela Harrelson, said it was an emotional experience to be in the court and repeated calls for justice.
If we can get a conviction and hold these people accountable, that would be justice. And I just hope that we do. I know that we're in for a fight, I know that, but I'm still holding on to that.
Robert Pauley represents former Officer Tao. He's calling for the trial to be televised.
I find it ironic that the Attorney General's office and the rest of the public officials who've been commenting publicly on this case and leaking sensitive information now want to keep the trial not open to the public.
Monday's pre-trial hearing gave an outline as to what to expect in the coming months. Questions as to whether the trial will be televised should be decided by the next court date, which has been set for September. The first trial date has also now been set for March next year.
The government of Spain says it will open up the country to foreign tourists from tomorrow, July the 1st. This is an effort to revive the tourism industry that has faced new challenges and is trying to claw its way back from the economic damage caused by Covid-19. As correspondent Rahul Patak reports, the resort city of Benidorm is a case in point.
Benidorm is the resort that invented the low-cost beach holiday back in the 1950s. Its mix of sun, sea, sand at an affordable price persuaded 16 million people to visit last year. Covid-19 has changed all of that. The Spanish government has promised a $4.79 billion rescue plan to help tourism, but experts say that falls well short of what's needed for an industry that provides Spain with 12% of its GDP.
Evidentemente es muy grande. Pensemos que Benidorm es turismo. Benidorm es uno de los grandes destinos del mundo.
We are really worried. Benidorm is one of the biggest tourist destinations on the planet. Our economy is linked to tourism. We're worried, but the only way is to activate protocols to guarantee safety and make sure people feel safe, that the people coming can see it with their own eyes and share it with others.
Cada actividad y servicio turístico.
And this is how Benidorm are trying to keep people safe on the beach. Segregated sections, reduced opening hours, and of course, less sunbathers. Normally there would be 40,000 people on this beach during high season. Now if you want to sunbathe here, you're going to have to book one of these spots online or speak to a beach monitor and get it organised. It's all part of the new normal if you want a holiday here on the coast. And that new normal also extends to the bars and hotels that stretch along Benidorm's coastline.
Se están tomando todas las medidas sanitarias. Eso incluye
We are taking all safety measures here. That includes people disinfecting their hands at the entrance, placing them at a fully disinfected table, and when they leave, we disinfect everything again. We have changed the menus. They're one use only. They go to the trash after. The cutlery comes in individual bags, so nobody touches them but the client.
Que la utiliza un cliente nada más. Una vez que termina ese cliente, se tira.
There are hopes that by August, Benidorm could look something like its old self, albeit with fewer visitors. This break with business as usual has prompted some to say that Benidorm and Spain as a whole should rethink how it markets itself to tourists and move away from the low-cost model that it helped to create.
China-Japan Friendship Hospital in Beijing, which has a long history of treating foreign residents, is popular among foreigners these days for a different reason: COVID-19 testing. The hospital now provides nucleic acid tests for people without coronavirus symptoms or likely exposure. Correspondent Wu Kushkun reports.
Sasha is from France and works in a hotel in Beijing. He booked this test last week.
I checked online and I found the list of all the hospitals in Beijing, and this one was near my place. I come here so I can have first for my health to make sure I don't have the virus, and also so if I want I can travel in China.
The China-Japan Friendship Hospital has been offering medical services to foreigners since 1984, as one of the earliest to do so in Beijing. The international department now provides nucleic acid tests for people without coronavirus symptoms or likely exposure.
People can book the tests through 4 hotlines or our app. You're likely to get an appointment 2 or 3 days ahead. Results will come out within 24 hours. You don't need to print the report. Beijing residents can check on the WeChat mini program, Beijing Health Kit.
Since this March, the hospital has been offering tests for foreign diplomats and their families. As of June 21st, they had tested 102 people from 19 countries.
我们接到这个任务是在疫情期间
This March, amid the outbreak, the Foreign Ministry and Beijing municipal government asked us to provide epidemic-related services to foreign diplomats after they entered China. When they were in their 14-day quarantine, we sent staff to their hotels to collect their swab samples. We also provided treatment for other diseases for them while in quarantine.
The General Hospital is planning to build a public health emergency building to integrate a fever clinic, infectious disease department, as well as intensive care units to better address future public health risks.
Earlier this month, the Beijing municipal government issued a 3-year action plan to improve emergency public health response. This hospital has been designated to treat foreign patients in case of an emergency.
Up next, sport. Valencia sack manager Celades, sport director Sanchez resigns.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In sport, La Liga has provided 2 masterclass sessions for coaches of the Nigeria Women Football League. La Liga Women's Football coaching methodology is some selected content that is part of a new comprehensive program developed by La Liga. The original program consists of a series of in-person courses focused on the specialties of women's football. Valencia has sacked manager Albert Celades after only 9 months in charge, while sporting director Cesar Sanchez resigns. Vero Gondoliz has immediately replaced Celades as manager until the end of the season. Celades is the 6th manager to be dismissed since Singaporean billionaire Peter Lim bought the club in 2014, while Sanchez, who was appointed in January, is the 6th sporting director to leave. Valencia are 8th in La Liga and have lost 3 of their past 4 games. That is in the news this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.